we think of kids and dental health, we think of brushing your teeth, but infections are common problems for many young children. Here's Dr. Julia Arana with Children's Hospital to talk about dental infections and what parents need to do.
In children, it's not quite as obvious as in adults because we are more aware. So they do get pain and sensitivity when they have cold things, when they bite down. And sometimes that will present only as not wanting to eat because children can't really tell you why it's hurting or what's making them not want to eat. So if your child is refusing to eat or takes one bite and then stops taking any bites, you would want to make sure you look in the mouth. And what you're looking for is you could see swollen or red gums. So gums should be healthy. Gums are nice and pink. Infected gums become red and swollen. And then that swelling can sometimes lead to swelling of the neck or jaw. So if you're seeing swelling down below the neck, along the jaw, and then of course if it's up into the face, that's more serious. And then sometimes you'll see just simply a darker tooth. Again, that can be from damage of the root, but it can also be early infection. Bad breath. Kids can have bad breath just like adults, but that shouldn't be persistent all the time. So if that's persisting, you need to have them seen. And then if the infection is serious enough, you'll see fever. Sometimes systemic symptoms like vomiting, diarrhea, that's because the infection gets into the bloodstream and surrounding tissues and they become septic. And so those would be very serious signs, but it's sometimes what you see. Their immune system is weaker than adults. So it's not weaker, it's less mature. And so it takes time for that to get better. Then the addition of that is the poor dental hygiene and poor diets of children. So they can eat sticky, hard candies or gummies, vitamins, and those little things will get stuck in their teeth. And then when you try to brush them, we all know who've had children or have tried to brush a child's teeth, how difficult it can be to get that back there and get those molars. And then they often will be given something sweet or something with sugar in it to sleep with. So going to bed with a bottle or a sippy cup that has something with sugar. And once they have those molars, that really, just sets them up for infection because they can have more crevices and cracks in their teeth, in those little immature baby teeth, than the mature adult teeth. And so that sitting there all night can really lead to serious infections and cavities. We would hope that you're going to your dentist for routine checkups so we can kind of detect problems before they become serious. If you think your child has a dental infection, and they're not eating, they don't have fever yet, the dentist would be the first place to start, or even your pediatrician if you feel like you see some swelling of the gums. When they're developing fever or swelling of the face, that kind of elevates it and you need to go to the ER because they could have an abscess. Children with abscesses often require hospitalization and surgery.